Have you ever really stopped to think about how much might be going on beneath the surface? Even with animals we see every day, like our horses. It's kind of amazing how many subtle clues we can miss until we really, dig into a topic. Welcome to the Deep Dive. This is where we take your sources, pull out the key insights, and hopefully give you a shortcut to getting up to speed. Today we're doing a deep dive into a condition that, well, it might be less common, but it can have a really profound impact on horses. Chronic kidney disease. So our mission is to unpack this. Look at the complexities, right? From how it starts so subtly to managing it long-term, all based on the information you've given us. We'll explore what it is, why it might happen, the signs to watch for, how vets diagnose it, and what the options are for management.
Yeah, and what's really striking, I think, is just how insidious this disease can be. Often it's hiding in plain sight until quite a bit of damage has already happened. So we'll try to shine a light on those early signs, those indicators you might miss, and really stress how critical it is to understand the disease's progression. Okay, let's dive right in then. If we're talking equine CKD, where do we start? What exactly is chronic kidney disease in a horse? How's it different from, say, a sudden kidney problem?
Right. So fundamentally, chronic kidney disease, CKD, is a progressive condition. And importantly, it's irreversible. It's characterized by a pretty substantial and permanent drop in the kidney's filtering ability. We call that the glomerular filtration rate, or GFR. Think of it like how well those tiny filters in the kidneys are cleaning the blood. Now, unlike acute kidney injury, AKI, which comes on suddenly and, might actually be reversible,
Right.
CKD develops slowly. We're talking typically over months, sometimes even years.
Yeah.
And this brings up a really crucial point about actually spotting it. How much kidney function does a horse have to lose before we even see any signs? It's quite remarkable, actually. The kidneys losing their ability to concentrate urine properly, that leads to something called isostenuria.
Isotenuria.
Yeah, isostenuria. It means the urine-specific gravity is kind of fixed in this dilute range between 1.008 and 1.014. That doesn't happen until more than 2/3 of the nephron function is gone.
2/3, wow.
Exactly. And azotemia, that's the buildup of waste products like urea and creatinine in the blood that only develops after more than 3/4 of kidney function is lost.
3/4.
Think about that. By the time you might notice something is off, a huge amount of function is already gone. It really highlights the challenge in catching this early. You, the owner, paying attention to subtle shifts is just paramount. We're often playing catch-up with CKD.
That's a staggering figure. It really puts it into perspective how quietly this can creep up. So connecting this to the horse's overall health, what does this mean beyond the kidneys themselves? How does it ripple outwards?
Right. If we step back and look at the bigger picture, CKD isn't just a kidney issue. It really does impact numerous body systems because, well, kidneys do so much. You'll see disturbances in fluid balance, electrolytes, acid-base balance. There's often decreased production of erythropoietin.
That's the hormone for red blood cells, isn't it?
Exactly. So that leads to anemia. Then you have gastrointestinal issues, maybe a poor appetite, sometimes diarrhea, and definitely an increased risk of ulcers. And it doesn't stop there. Even the nervous system can be affected.
Right.
You might see occasional ataxia that's like, a lack of coordination.
Right, sure.
Or even dementia in really severe cases. Or tremors, muscle twitches. Those often go along with the metabolic problems. And there can also be issues with blood clotting, like platelet dysfunction, and horses can become more susceptible to infections.
Okay, so it really has wide-ranging effects. And how often do we actually see this? What's the incidence rate?
The reported rate is around 0.12% in the general horse population. But for older horses, say over 15 years old, that prevalence can go up to about 0.5%. So still not super common, but definitely more frequent in seniors.
Okay, 0.5% in older horses. Now, this is where it gets really interesting for horse owners listening. Are certain horses just more likely to get this? Any specific risk factors or breeds?
Yes, definitely. Age is a big one. Older horses, generally over 15, are at higher risk. In terms of breeds, well, there's some suggestion Clydesdales might be more commonly affected. And there's a specific inherited form of polycystic kidney disease, PMD, that can show up in Arabians and paints.
PKD. Okay. And what about the actual root causes? You mentioned it develops over time, but what kicks it off? It sounds like it could be a few different things.
That's right. It's often a complex picture, and honestly, we don't always find a single definitive cause. But a really common pathway is previous acute kidney injury, or AKI. So if a horse has a severe bout of AKI, maybe from really bad dehydration or certain drugs, or maybe sepsis, a bad infection, and if that kidney injury doesn't fully heal,
Okay.
That permanent damage can then kind of smolder and progress into chronic kidney disease over time. And thinking about things owners use commonly, medications are a big one. Non-steroidal anti-inflammatories, NAIDs.
Like Beirut or Banamine?
Exactly. Phenylbutazone, flunixin, miglumin, they're a significant concern, particularly if the horse is dehydrated or has low blood pressure when they get them. They can cause something called renal papillary necrosis damage to a specific part of the kidney. Also, certain antibiotics, the aminoglycosides like gentamicin or amikacin, they can damage kidney cells too, especially with long-term use or, again, in dehydrated horses.
Good to know. What else?
Well, other causes could be things like prolonged periods where the kidneys just aren't getting enough blood flow, think severe dehydration again, or shock. That can cause tubular necrosis, basically death of some of the kidney tubule cells. Pigment nephropathy is another one. That's when pigments from really severe muscle damage, like tying up, or from red blood cell destruction become toxic to the kidneys. And then you have chronic inflammation within the kidney structures. Sometimes that's from bacterial infections moving up from the bladder. That's called pyelonephritis. Or it could even be immune-mediated, where the horse's own immune system attacks the kidneys.
Wow, lots of potential triggers. You mentioned earlier, what about kidney stones and even plants? Can plants really cause kidney disease in horses?
Absolutely. Kidney stones, the technical term is nephrolithiasis. They're less common as a primary cause of CKD, but they can definitely form and block the ureters, those tubes, from the kidney to the bladder. And if that happens, it backs urine up and damages the kidney. Horses are actually quite prone to forming calcium carbonate stones because, unlike many other animals, they get rid of excess calcium through their kidneys.
Interesting.
And yes, toxic plants are on the list too. Things like acorns or plants containing oxalates can certainly cause kidney damage if ingested. And then rarely you might see congenital issues like underdeveloped kidneys or even certain types of cancer leading to CKD.
Okay, so since this develops so slowly, so subtly, what should our listeners be watching for? What are those key things in a horse's history or the physical signs that might make someone think, maybe I should get this checked out?
Yeah, this is the tough part because, as we said, the signs are often really insidious, very nonspecific. And they typically don't pop up until that, significant 75% loss of function has already occurred. Probably the earliest and most consistent sign you might notice is the horse drinking more and urinating more. We call that polyuria and polydipsia, PUPD for short.
PUPD, okay.
The damaged kidneys just lose their ability to concentrate urine, so the urine becomes very dilute, and the horse naturally compensates by drinking a lot more water to try and stay hydrated.
That makes sense. What else?
Other common signs, but again, often gradual, are things like lethargy, just not having their usual energy. A partial loss of appetite, maybe picking at their food, weight loss over time. You might also notice things like a poor hair coat, maybe some swelling under the belly or on the legs, that's ventral edema, sometimes increased tartar on the teeth, or even a sort of ammonia-like uremic smell coming from their mouth because of the waste products building up.
Uremic odor, right?
Anemia, that low red blood cell count, is pretty common too. And then in really end-stage disease, you can see more severe neurological signs like that ataxia, the lack of coordination, or hypermetria, which is like an exaggerated gait, and just a general dullness, what we call mental obtundation.
So quite a range of signs, but mostly subtle until it's pretty advanced.
Yeah.
If an owner does notice some of these things, how does the vet actually pin down a diagnosis of CKD?
It's definitely a comprehensive approach. Blood work is absolutely crucial. We look for elevated serum creatinine and blood urea nitrogen, BUN. Those are key waste products the kidneys should be filtering out. Creatinine is generally considered a bit more reliable than BUN in horses because BUN levels can be affected by other things, like how much protein is in the diet.
Okay.
Now, a really important question comes up here. How do we tell the difference between true kidney failure and maybe just dehydration? Because dehydration can also make those creatinine and BUN numbers look high, right?
Right, that seems tricky.
It is. So a fluid challenge is often key. This involves giving the horse intravenous fluids, usually for about 12 to 24 hours, and then rechecking those blood values. If the BUN and creatinine drop significantly with fluids, it suggests it was likely pre-renal azotemia, meaning the problem wasn't the kidneys themselves, but that they weren't getting enough blood flow, probably due to dehydration.
Oh, okay.
But if those values stay stubbornly high even after fluids, then primary kidney disease, either CKD or maybe AKI, becomes much more likely. And there's something pretty unique about horses with CKD too. We often see hypercalcemia.
High calcium.
Yeah, higher than normal blood calcium levels. This happens because because, as we mentioned, horses rely heavily on their kidneys to excrete excess calcium. When the kidneys fail, calcium builds up. Phosphorus levels, on the other hand, can be variable, sometimes high, sometimes low, sometimes normal. Urinalysis is equally vital. Checking the urine. We look for that isostheneria we talked about, that fixed dilute specific gravity between 1.008 and 1.014. That's a real hallmark of CKD because it shows the kidneys have lost their concentrating ability. We also look for protein in the urine. We can quantify it using a urine protein-creatinine ratio, which can help tell us if there's damage to the glomeruli, the main filtering units.
Okay, blood work, fluid challenge, urinalysis. What about things like ultrasound? Can you actually see changes in the kidneys?
Yes, ultrasonography is very valuable. It lets us actually visualize the kidneys. We might see changes like the kidneys being unusually small, maybe with irregular outlines or surfaces. We can also look at the internal structure. Sometimes we see increased echogenicity, meaning the tissue looks brighter on ultrasound, or a loss of the clear distinction between the outer part, the cortex, and the inner part, the medulla. These suggest chronic changes. Ultrasound can also help us spot things like kidney stones or cysts, like in that PKD condition. And in some specific cases, a vet might consider a kidney biopsy for a really definitive diagnosis, but that does carry risks, mainly hemorrhage, so it's not done routinely.
Right. Makes sense.
Yeah.
So once you have that diagnosis, what can actually be done? You said earlier it's irreversible, which sounds pretty tough.
It is tough. And you're right, the damage is largely irreversible. So treatment really focuses on being supportive. The main goals are to try and slow down any further progression, manage the clinical signs the horse is showing, and most importantly, maintain the best possible quality of life for as long as we can.
Okay, supportive care. What does that look like in practice?
Dietary management is absolutely paramount. Number one goal is maintaining appetite and body condition. You want the horse eating enough calories, but you want to avoid excessive protein.
Why less protein?
Because protein breakdown produces those nitrogenous waste products like BUN that the failing kidneys are already struggling to get rid of. So less protein means less waste buildup. Good quality grass hay is generally preferred over something like alfalfa because alfalfa tends to be quite high in both protein and calcium.
Oh, right, because of the hypercalcemia issue.
Exactly. Since high calcium is so common and unique in equine CKD, restricting calcium intake is really crucial.
Okay, so diet is key, lots of fresh water, I assume. And careful hay selection. What about medications? Anything specific there?
Constant access to fresh, clean water is absolutely essential. Can't stress that enough, especially since they're often drinking more to compensate. As for medications, well, those NSAIDs we talked about, bute, banamine, they have to be used with extreme caution. Really, only if absolutely necessary for pain relief at the very lowest effective dose and with super careful monitoring because they can definitely make kidney function worse.
Okay, so avoid them if possible.
Pretty much. We might use gastroprotectants like omeprazole to help manage uremic gastritis, that stomach inflammation caused by the uremic toxins, or to prevent or treat ulcers, which they're more prone to. In some specific situations, drugs called ACE inhibitors might be considered if the horse has high blood pressure or significant protein loss in the urine, but their use isn't as routine as in, say, dogs and cats with CKD. And really, tying it all together, careful and consistent monitoring is vital. Keeping track of the horse's clinical condition, their body weight, their appetite, and doing regular blood work and urinalysis to see how things are progressing and how they're responding to the supportive care.
It sounds like a lot of careful management. Given how serious it is and how much function is lost before signs appear, what's the general outlook? What's the prognosis typically like once a horse is diagnosed?
Honestly, the prognosis for CKD in horses is generally considered guarded to poor, especially once those clinical signs become obvious and the azotemia, the waste buildup in the blood, is persistent. It goes back to that huge reserve capacity the kidneys have. By the time we see signs, the disease is usually quite advanced. And because it's progressive by nature, we know that kidney function is going to continue to decline over time, even with the best possible management.
That's sobering.
It is. Factors that influence how long a horse might do okay include just how severe that azotemia is, and critically, whether the horse can maintain a decent appetite and body condition. But even though there's no cure, getting an earlier diagnosis allows for that proactive management. It lets us put those supportive measures in place to try and slow the decline and maximize the horse's comfort and hopefully their longevity.
This whole deep dive into equine CKD, it really does hammer home how vital it is to just watch our animals closely. Notice those subtle changes.
Yeah.
For me, I think the most startling thing was that figure losing 3/4 of kidney function before you even see waste products build up in the blood. Just incredible. What stood out most to you?
Yeah, that figure is always striking. I think for me, it's that combination. The
Yeah.
fact that while CKD isn't maybe the most common disease horses get, its impact is so profound because of that hidden progression. So much function can be lost before anyone even suspects a problem. Just really underscores the value of those routine vet checkups, sure, but also just paying really close attention day in and day out to those slight, maybe persistent changes in your horse's behavior or their physical condition. Don't ignore the little things.
Absolutely. So thinking about this for you, our listener, maybe consider how knowing about these subtle signs, knowing about the irreversible nature of CKD in horses, how might that influence how you approach routine care and monitoring, not just for horses, but for any animal in your life? What seemingly minor changes, things you might otherwise brush off, could actually be significant clues for other chronic conditions that might be lurking beneath the surface, something to think about.